Did you know that the signs of postpartum PTSD and PTSD are essentially the same? In this video, I'm going to go over what those signs are. And my reason for helping you understand what PTSD is that finding this diagnosis is helpful. It's helpful in unlocking treatment modalities and perhaps medication if that's what's indicated. My name's Allison Lorne, and I'm a certified nurse midwife. My work is in helping people recover from traumatic childbirth experiences in a way that highlights their resilience and heroism. Click the link on my bio to visit my website and learn more about what I have to offer. I'll also include my free postpartum care checklist in the comment section. It's full of tips and tricks to help create more ease and flow in the postpartum period. PTSD stands for post-traumatic stress disorder. This is a diagnosis that was developed after soldiers returned from the Vietnam War. Previously referred to as shell shock, there was a recognition that soldiers after combat often came back as changed people. Now, PTSD is a syndrome, and that means that it's made up of lots of different symptoms clustered together that can contribute to the syndrome definition. That diagnosis, then given to a patient, helps providers understand the best way to help treat that patient. Now, postpartum PTSD refers to the birth experience contributing to trauma and PTSD developing after a childbirth experience. This could also happen during pregnancy. It doesn't have to be just birth itself. Postpartum relates to anything pregnancy related. But of course, childbirth is when we most often see trauma occurring. So, what's interesting to note is that when the definition and diagnosis of postpartum PTSD became familiarized to providers, it essentially equates what childbirth trauma might affect a person similarly to combat. It's that serious. It can also be referred to as assault victims and likened to other survivors of traumatic experiences, such as natural disasters. So, I can appreciate the use of postpartum PTSD because it really recognizes how traumatic childbirth can be. That being said, let's go over some of the signs of PTSD. So, categorizing the symptoms of PTSD is helpful. First, let's just talk about mood. When we see PTSD manifest in mood, it often looks like irritability, being on edge, nervous energy, anxiety. So, this traumatized personality often feels brittle. And that's a word that describes the inability to really tolerate a lot of stress. So there's so much coping already happening in the brain that outside stressors often there just isn't a lot of bandwidth for having to deal with these outside stressors. So what might be like a small request can often just end up being blown out of proportion or having like a really snappy response. So when we're looking at mood, it's often a depressed mood. Sometimes it will be, it comes across like lost in thought. Um, and sometimes it's just like that person's so overwhelmed with what's going on in their head that they're not really able to engage in conversation or what's happening in the room around them. They might be staring out the window more often. They might be just looking kind of glazed over. And that's because they're caught up in perhaps reliving the event, a flashback, a memory, or just trying to maintain a connection with what's going on in the room or what's going on around them. When we talk about sleep, we see PTSD exhibit in a lack of sleep. That can be insomnia, like difficulty getting to sleep, or difficulty staying asleep, waking up for no reason, and then just really not being able to get back to sleep. And it can also look like nightmares. Unfortunately, the nightmares can be really disturbing. It can be feel like people wake up in the middle of the night as if they're just in the middle of the event all over again. And we can already understand that people are having a hard time sleeping with a newborn at home. So, this symptom of trauma can make it just even more difficult. Again, one of the other signs of PTSD that we see is the experience of flashbacks. And this is really about reliving the event. And unfortunately, it's like the subconscious just doesn't know what's happening in real time and what's happening in the past. So, suddenly you're in the event all over again, and the body is responding with increased heart rate, increased respirations, shortness of breath, sweaty palms. You could feel nauseous, you could feel faint. And this is all because the body is just completely like back in the event itself. It can even feel like people aren't safe around you and that you need to get away from everybody. Um, so the part about flashbacks is that there's often triggers that bring the patient into the flashback experience. And triggers could be any kind of occurrence that's happening in the world around you that has enough similarity to what happened in the original event that it brings you right back to the original event. So let's say you had a nurse that came into the birth room and used a tone of voice with you that vaguely reminds you of your mother's voice. And you might not have even realized it at the time. But then your mom calls and you talk to her on the phone and she says something that sounds exactly like what the nurse said right before things started going totally haywire. And suddenly you're just like back in the birth experience all over again. It can just be the sounds of alarms that were similar to alarms that were going off to the machinery that was in the room, or even just the rustling of paper, whatever feels like it is close enough to the sounds, sights, smells, any sort of sensory stimulation that was happening at the time of the original event that brings you right back into it. It's really the power of memory, and it's amazing how much our memory informs our body, because when you realize you're reliving the event with all the adrenaline, all the cortisol, all the chemicals that are happening in your body because of your brain reliving a memory, you realize how important it is, that brain body connection, and how much working with that memory can really affect your present moment. So, postpartum PTSD is different than just regular trauma in that it's hard to control. It interferes more with your daily life. It happens unpredictably. The flashbacks, the difficulties might really interfere with your ability to execute tasks. And maybe you're going to the grocery store or the post office, and someone behind you unzips a purse and it sounds like something that got unzipped at the time of the birth. Suddenly you're reliving a flashback, and maybe you can't even make it up to the counter to send your package off. Maybe you just have to abandon your task, get in the car, and go home. That's what we say, it's interfering with your activities of daily living. And if that's happening so much that it's becoming a handicap, then it's probably time to seek professional help for PTSD. And that looks like psychiatric support. And by that, I mean counseling and perhaps medications. Now, there's all kinds of modern modalities to help deal with PTSD and trauma. EMDR, eye movement repatterning, and desensitization is one of my favorites. I've used it myself a whole bunch, and I found such incredible results from EMDR. And I'll go into that more in a different video. But what I have to offer you is a community. And this is a community of people that have gone through traumatic births, and groups that I facilitate to being uplifting, solution focused, and really support driven. This isn't a group where people are just going around and sharing sad stories. My goal is that every group you feel like there's some sense of resolution and hope in your own healing. I also offer one-on-one coaching and counseling. You can find all that in my website, and I encourage you to click the link in my bio to find out more. And please, by all means, download the postpartum care checklist. I'm sure it can help you in some way if you're having any trouble in the postpartum period. My name's Allison Lorne. Thanks so much for watching. This is Holistic Birth Recovery.